Welcome, everyone, to the Bob and Brad podcast. My name is Mike Keenitz, and today we are going live with special guest Rick Olderman. So thank you so much for joining us today, Rick.
Hey, Mike. Good to see you again.
So we are taking some of our audience's questions on shoulder pain specifically today. So we have a lot of responses and questions to go through. We will get through as many as we can in the next hour or so. And if you have some comments, you can certainly leave them on this live event and we'll try and get to them as well. So, Rick, do you want to give people a little bit of information about you before we get going?
Oh, well, I'm a physical therapist, sports and orthopedic physical therapist for over 25 years. Owned my own clinic, sold it a couple years ago. Recently wrote a new book and co-wrote a book with you guys called Top 3 Fix. And so, yeah, that's basically me.
If you want to check out Rick more, you can go to rickolderman.com and all his work's over there. So I think we'll just get into the questions. So our first one comes from Chris Johns. He says, I hurt my shoulder trying to restrain my dog front, I'm guessing front shoulder. And with care and movement, the pain went away over several months. Occasionally it flares up, sometimes just from sleeping on that side. I would appreciate movement exercise suggestions to strengthen it and keep full range.
Yeah, so it's really important with any injury, but in particular shoulder injuries, to think of the mechanism of injury, because that tells us a lot about what could potentially be going wrong here. And when I hear of a dog jerking on a leash and pulling someone's shoulder forward, after which they have pain, I don't know how old Chris is, but let's assume it's a young to middle-aged person. Usually that involves some kind of structural tear, like a labral tear, or something, a rotator cuff, partial tear, something like that. Especially if you're younger, in your 20s, 30s, 40s, or even 50s, if pain persists like what Chris is talking about, then it's more likely that it's probably a small tear that you've sustained, which isn't, and I know Chris was looking for strengthening exercises, but strengthening exercises won't fix tears. And so they can help them, and then the body will heal tears, but nothing is going to fix a tear. So it sounds to me, Mike, that they haven't really got an image of the shoulder yet. So that would be my first recommendation, is to actually see what you're dealing with. And an X-ray won't show soft tissue lesions, but MRI will. And especially if this has been going on for several months, I'm going to suspect a soft tissue lesion of some sort, like a labral tear or a rotator cuff tear. Now, even if you have a rotator cuff tear, you don't necessarily have to have surgery for that, or even a labral tear for that matter. But what I find when you get these images is, if it's, say, a partial tear or a small labral tear or something like that, you can choose not to have surgery if you have 90 or 95% of your function and you don't want to go through all of that hassle, then don't go through that hassle. But what's really nice about knowing what the actual problem is that you can compartmentalize what's happening to you. So whenever you feel that little pain in your shoulder, oh, there's my labral tear, and you can not worry about it and not have it consume you for the rest of your life, or for at least for the next few years. So that would be the benefit. And also, maybe it's a more serious thing that if you catch it now and have a really simple surgery, like a stitch or two in the rotator cuff, rather than a full tear of a rotator cuff or some other tissue, then you could head off a much harder road to go if you wait too long and that tear just keeps growing and growing and growing. Then it becomes a more serious surgery. So my recommendation is to get the image and see exactly what this is.
Yeah, I have a patient recently that's 70s or 80s, had this exact thing happen, but hers was really bad tear, so she had to have surgery for hers. She tore her rotator cuff, so it's important to get it checked out. And I've also worked with people where I'm like, they had shoulder surgery, and I was like, so what caused this? And they're like, oh, there's about 3 things over the last decade that just added up, and now I need surgery. And they're in the whole big spiel. And a very advanced large rotator cuff recovery can be like 6 months to 9 months, and a small one can be like 3 to 6 months. So if it's a smaller one, yeah, it's kind of best to do surgery a little bit sooner. So
Yeah. So Chris, I'm sorry, I'm not avoiding your question about what to strengthen, but I don't know if strengthening is the right way to be thinking about this pain that you have. And I'm sure you've already looked at tons of strengthening exercises, videos. I wouldn't have anything to add, to those, that are already online for traditional rotator cuff strengthening. Clearly, I'm going to guess by the fact that you're asking the question, you've probably already tried that and it's not working. And the reason it's not working is because you may have a larger structural problem going on here.
our next question comes from Stacy. She said 6 years ago I had surgery, and 6 months after that I got a frozen shoulder. The shoulder is mostly healed, but I think there is just a little bit of adhesion left. When I lie on the side to sleep, my arm doesn't fully flat like the other side does. Any exercises for that? It sounds to me like Stacy needs to do a little bit more stretching. I don't know what her range of motion was like after her initial surgery before frozen shoulder, but it sounds to me like she just kind of needs to stretch it out a bit more.
Yeah, I'm kind of curious about this, Mike. What do you think? How do you think she's lying down? Do you think she's lying down with her arm like this when she's lying down? Or because if it's underneath here, I don't see how that can't, come against your side. So I'm going to guess that her arm is like this in some way. Is that your guess of
Yeah,
this?
because
How
she
she's
says
sleeping?
she lies on her side.
Right. So she's lying on her side with
Is
maybe her hand
she
underneath her head
this? Is she
or
this
this. I'm
side
not sure.
sleeper, or is she this side? Yeah, that's a good point.
Yeah.
I
So
would
anyway, is it Stephanie? Is that what her name
Stacy.
was? Stacy. Okay. So Stacy, if you're lying with your hand underneath your head, then that requires a degree of external rotation of the shoulder joint. And so this is the range of motion that's most compromised with a frozen shoulder issue. And for those of you who don't know what frozen shoulder is, basically our shoulder joint is surrounded by a joint capsule that holds everything in place, and rotator cuff muscles insert into that joint capsule. And no one quite understands why this happens, but after trauma, usually it's trauma, sometimes it's spontaneous. What happens is everything just starts to tighten down, and a person goes through a period of less and less range of motion and more pain with any attempt at range of motion. So usually this lasts at least a year. So the fact that Stacy came out of this in just 6 months is, I think, extraordinary right off the bat. But I'm going to guess that with the range of motion that she's missing still is this external range of motion needed in order to put her hand underneath her head. So if I'm lying down, then my elbow must come like this. All right. And so that is more external rotation of the shoulder joint necessary. So my guess is if we just want to focus on your sleeping, Stacy, if that's because it sounds like you have basically everything else back together again. So what you might want to try doing is putting a pillow underneath your waist, and then you have another one underneath your head. And so that creates a trough for your shoulder to go into. And what that does is it doesn't require as much range of motion in your arm to sleep as if you didn't have that pillow. So a pillow underneath the waist. And so if I've got my skeleton here, if I can get it off the hook. All right. And so just going to grab a little thing here. So if I'm laying down, I'm putting a pillow underneath my rib cage like this. And you can see that creates a little trough for my shoulder to fall into. And it gives it more degrees of freedom to move in that situation. And so I don't have to have perfect range of motion in that situation. I can get away with a little shortness. So other than that, I mean, the fact that you've gotten this much back means that you've probably been going to physical therapy to regain the range of motion that you do have. And you've probably seen every stretch possible out there already. So that would be my recommendation, is to try that little recommendation. And then also sometimes exercise helps loosen up that joint capsule. So if you have a little, maybe before bed time routine of, doing some shoulder overhead presses and things like that, so with really light weights, just to get the whole shoulder joint moving, that might loosen it up enough to sleep with that hand under your head, or however you're sleeping, that you're not able to do that.
Our next question I'm going to take from audience member watching right now, because I think it'll be pretty quick to kind of answer. But Michael Howard says, I have both left and right shoulder, have sharp pain that radiates down to my hand. I have very limited movement in both arms. This has been going on for several months. And Michael, it sounds to me like you have a nerve issue radiating from your neck or in your shoulder complex somewhere.
Yeah, I would tend to agree. It's definitely a nerve issue. So hopefully, Mike, you've gotten that checked out as to what the nature of it is. But let's look at a bigger picture, maybe about why you're having a nerve issue. So if we look at the shoulder system, all right, we have two shoulder blades, and we have significant muscular attachments that go into the neck bones and the base of the skull. If there are shoulder issues, if there are problems with how your shoulder blades are resting or moving, then stress is transmitted via one of these muscles, in particular the levator scapula, which inserts into C1 through 4 and sometimes 5. And that can cause cervical compression. It can also cause side bending and rotation of the cervical spine. And if this has been going on for a long period of time, it could potentially cause, disc bulges, bony changes like bone spurs and things like that, that are then now pressing on the nerve roots that are then occluding the nerves that are running down your arms. So I agree with Mike that you should first get this checked out and make sure that you don't have a serious cervical issue going on. And if you do have a history of shoulder problems, then it's likely that your shoulder blades are not working well. So one of the ways to get those working well is to, if you just get on your hands and knees, and your hands are weight bearing on the ground like this, and then you rock back on your knees, it pulls your arms up overhead, and it helps stretch a lot of the muscles that are attaching from your trunk to your shoulder blades, and also the shoulder blades to the arms, and helps get the shoulder blade system moving better. So while that may cause temporary occlusion of the nerves going down your arms and increase the radiation symptoms temporarily, if you do this for a day or two, a few times a day, you might notice then that the radiation is decreasing. And if that's the case, then it's a sign that the shoulder blades are likely a source of your problem. Now, another way that you could do this is simply, if the radiation is happening, let's say while you're sitting, you could just put a big pillow underneath your armpit here, and have it push the armpit up about an inch higher than usual, and then rest your hands on top of that pillow like this. So now your shoulders are being held up higher. And if this gets rid of the radiation symptoms that you're experiencing, then it's likely that your shoulder blades are actually what are stressing your cervical spine, and then which is then causing the radiation symptoms. Because if you do put pillows underneath your armpits and rest your arms on them and elevate the shoulder blades, that shouldn't affect the spine at all if the problem was solely coming from the cervical spine. But it's often the case, in my experience, working with more chronic pain cases, is that chronic cervical neurological symptoms are being caused by the shoulder blades themselves. And actually, I mentioned this, Mike, in our top 3 fix book that Bob and Brad and I co-wrote. I mentioned how the system works, and some of those exercises in there might be beneficial for this guy.
I will admit that it was mainly Bob and you, and Brad and I were just some video exercises in it. But
well, you're a great moral support, Mike.
Thank you. Brad and I, authoring is not our strong suit. Anyway. Yeah. Our next question comes from another Mike. I swear I'm not just picking Mikes because my name is Mike. The question is rather long, so I'm going to try to condense it a little bit. So I broke my right clavicle from a road bike crash. My shoulder hit the pavement going 21 miles per hour. They had their hands outstretched in front of them when they fell. Broke their clavicle in half. Surgery was 6 weeks ago. Ortho says x-ray the other day looks amazing. I could go back to life without restraints. Besides, I can't lift anything heavy. Basically, he's concerned about his shoulders. So just above his right armpit, I do have some tenderness still, tingling, definitely restricted motion, 5 out of 10 being pain. Basically wondering if there's anything he can do to kind of help with this.
Yeah, well, this kind of reminds me of the very first question we had too, in that we have to look at the mechanism of injury. So we have a very violent fall at high speed that was violent enough to break a bone in your body. And so, this is what's curious about this question to me, Mike, is that I'm assuming that the orthopedic surgeon did a full workup of all the shoulder tissues and maybe did a dye contrast MRI for the shoulder joint to assess whether there is a labral tear, especially if you land with your arms out like this, especially at high speeds. You're at a high likelihood to tear labrum in your shoulder and or other muscle tears, which would show up with dye contrast. And that's where they shoot your shoulder joint full of dye. And then they do an MRI to show where it's leaking. And that indicates tears. So, gosh, I sure hope this guy had that done.
It sounds like he hasn't done any physical therapy at all, because he asked, should I do physical therapy or should I use a sling temporarily? I would start with physical therapy and see if it helps. I mean, you can just YouTube Bob and Brad or some of Rick's stuff. And I mean, half of the stuff we're teaching nowadays on shoulder pain is Rick stuff anyway. So,
so I would definitely, gosh, if you haven't been to a physical therapist after clavicle fracture, it's important to understand that the connection, the shoulder's only bony connection to our trunk is the collarbone. Otherwise, it's a floating system on our body. And so when we have a disruption if we have a fracture here, it disrupts how our shoulder interacts with the rest of our body. And so when our arm is going up overhead, the shoulder blade should be rotating up and elevating to do that. Well, the collarbone is the pivot of that action. And so the collarbone needs to rotate and elevate with the arm when it's going up overhead. So if you have not been to physical therapy, that's one of the things that physical therapy will do with a collar fracture, is to assess whether the collarbone is actually rotating and elevating the way it should be with arm movements. So all of the pain that you're having with the arm movement may be because the collarbone itself is not moving, and therefore causing strain and impingement in the rest of the shoulder system.
I think that's a good answer. I don't have much to add to that.
And I'm not trying to market physical therapy as the end all be all, but I mean, a fracture with a shoulder system is so complex that, you really need to have someone who knows what they're doing with the shoulder system. And especially after a violent injury like this.
Yeah, it's one of the most commonly injured areas. Like 50% of the people I see in the clinic are shoulders or knees. So yeah, it's up there with common injuries. All right, our next question comes from Rini. So shoulder pain seems to go on and on, then migrate to the other side, then the back, lasting in various forms for a very long time. It's hard for her to get it under control and for a reasonable amount of time. She's curious, how much stretching should she do, or how much pain should there be afterwards? Is it productive? It seems counterproductive if she's doing these exercises and the pain is still there.
Yeah, so this is a tough one because we know nothing about this person.
Yeah.
We don't know if they've been to physical therapy, whether they've had an accident, whether they have old trauma to the shoulder that may have, several years ago that may now be manifesting as shoulder pain now. So there's a whole bunch of unknowns about this. if the pain is bad enough that it's nagging and she's writing in to us for help, then I sure hope that she has seen a physician to get going on x-rays and an MRI to determine what the nature of this problem is, first of all, to see whether there's something structural going on with the shoulder. So anyway, again, and I hate to sound like a broken record, but with a lot of parts of the body, you can get away with not having it checked out. But because there are so many moving parts to the shoulder system, and there are so many different tissues that can easily become torn or disrupted, it's really important to understand what it is you're dealing with. And the only way you can do that is to get an x-ray and or an MRI to see if you have structural problems going on here. So that would be my first recommendation. So my second recommendation is, and I'm also going to guess that you've been doing a lot of exercise already, but most of the shoulder exercises that we see out there, Mike, I don't know about you, but I see a ton of, you do a whole bunch of rotator cuff exercises. You anchor it from the inside to push out, and then you anchor it from the outside to pull in, and then shoulder shrugs and things like that. Well, I mean, those are really basic, and so they're not going to address the shoulder blade. And I found, in terms of chronic pain, shoulder blade dysfunction is the primary cause of pain. So this is the shoulder blade, and the way it works is there are rules about how it should be resting and moving. And one is that the spine of the shoulder blade here should be resting at about thoracic level 2. The spine of the shoulder blade here should be resting at about 3 inches from the spine of your body, regardless of whether you're 5 feet tall or 7 feet tall. And then that's when it's resting. And then if we move the arm up overhead, well, the whole purpose of the shoulder blade is to assist with the arm motion overhead. And so as the arm is moving up, the shoulder blade needs to upwardly rotate. Approximately 60 degrees is ideal, but I find that even 45 degrees on up is pretty good. The spine should elevate to cervical level 7, and then the bottom corner of the shoulder blade should be coming to the mid-thoracic spine, basically where the seam of your shirt is. So this is why it's beneficial to have someone actually assess what's going on with your shoulder, is because if you're messing up with some of these elements of it, restoring those often eliminates shoulder pain. But if all of those elements are intact and moving the way they should, then it's likely that we're actually dealing with a structural problem going on. So the shoulder blade is the key to understanding almost all shoulder issues, how it's moving and whether it's moving well. And then the final element of this is that there's actually something called the scapulohumeral rhythm. When the shoulder gets up to about 60 degrees or so of elevation, then the shoulder blade kicks into its upward rotation. And it should happen at a 2-to-1 ratio until about 120 degrees. This should be then fully rotated. And then the last 50 or 60 degrees of shoulder elevation are actually due to motion in the glenohumeral joint. But if your shoulder blade isn't rotating, let's just break this down really simply. If this thing isn't moving well, then when you try to raise your arm, what you're going to do is you're going to bump the humeral head into the bone of the top bone of your shoulder joint, and it's going to impinge and cause pain every time you raise your arm. And so this is why the shoulder blade is so important, and why a lot of people have chronic shoulder pain, is because often the shoulder blade does not move well. Again, this goes back to that other exercise I mentioned a couple times ago. A good exercise to get that started is just that simple all-fours rocking stretch, where you're rocking back on your hands like this. So this is where, if this girl doesn't want to go see a medical doctor, this is where I would begin to restore shoulder blade range of motion, which is likely, for some reason, not working well. Is just do some all-fours rocking stretches and see if that starts to, if she feels stretched, first of all, and then see if that starts to alleviate her pain and improve her range of motion, secondly. So that's where I would begin with that one. Long answer to a short question.
If you don't like getting on your hands and knees, for some people, you can do the all fours rocking just at a desk like I am and roll away from the table.
Absolutely.
You
Or
want.
you can, just walk your hand up with fingertips up a wall and then lean into the wall like that too.
Yeah.
So lots of different ways to achieve that.
Another question from a viewer right now. I can't answer a good chunk of this, but we can give a little answer. So Gail asks, are exogenous collagen shots beneficial for torn rotator cuff and partial tear of anterior supraspinatus? This is after PT has slightly helped. Can not do cortisone shots, or would more PT help me regain more side range of motion? Can't do snow angels. Going to orthopedic doctor tomorrow. I don't know what an exogenous collagen shot is. I'm guessing it's just collagen and they put it right into the rotator cuff. I've never worked with anyone that's had that shot. Cortisone shots seem to kind of be a band-aid unless you have like a frozen shoulder and it hurts and it helps you temporarily. I've seen it benefit then, but most of the time it helps for like 3 months or so, and then it's kind of back to where you're starting. So I think your orthopedic surgeon is going to give you the best advice tomorrow.
Absolutely, Mike. I agree. That's a very specific medical question that is pertaining to her specific medical situation.
Yeah.
And, we can't really give, I can't really speak intelligently about that. But what my initial question is, how did you get that rotator cuff tear? So was that due to a fall? And if it wasn't due to some traumatic accident, is it due to a movement dysfunction that you have? Like what I just mentioned, for instance, if the shoulder blade isn't moving properly, it will prematurely and excessively impinge that rotator cuff muscle and cause it to tear. So that's a possibility. Again, so many people are used to thinking about, if I have a rotator cuff tear, then what do I do kind of thing. But we have to step back a step and ask, why is this problem happening in the first place? And if we can answer that why, then we can often give a more complete understanding or picture of what needs to be done.
She said it's raking and sweeping. Movement dysfunction is my guess, is what Gail said.
Yeah. And just not that I want to complicate things further, but I mean, yes, and in almost all shoulder pain cases, movement dysfunction is one of the causes. But it's also possible that a lot of people see this top bone in the shoulder joint is called the acromion. And oftentimes there are different thicknesses of that acromion, and it's also angled differently in different people. And so you may have, for instance, a type 3 acromion, which is rotated significantly, and you may have a thicker acromion. So, which causes the supraspinatus muscle, which is running through that little cave, to get pinched too early and excessively because your acromion is not in an ideal shape. So what do they do for that? Well, they can shave the acromion to give it more space in there. And that may be why you're having the rotator cuff tear, in addition to the faulty mechanics. If you have changes in your acromion shape and thickness like this, then it's even more important to have absolutely, or as perfect as you can get, scapular mechanics, because the upward rotation of that shoulder blade is moving the acromion out of the way of the arm bone when it's raising up. And if that isn't happening, then you're just going to be bumping up into there, like I said earlier. So that's another thing to think about. And this is why, again, an X-ray and an MRI gives you so many answers to these often frustrating questions for these people. If they haven't had these tests and scans done, it can answer a lot of their questions about why things are happening and what to do about it.
She said they did get an MRI done, but they're going to tell her what it says tomorrow.
Okay. Well, yeah. Too bad we didn't have this the day after tomorrow, because then we get more information. But I hope you get the answers that you're looking for, and hopefully this, what Mike and I are talking about, will give you some information to ask your doctors about, what should I do now? So for instance, if you hear you have a type 3 acromion and it's excessively thick, then, personally, that isn't going to change, and it's going to cause probably worse problems on down the road. I would want to get mine shaved off a little bit to create more space in that area. So, but that's just me personally.
We have an interesting question from SP. It says, is going to a chiropractor okay? I would say if it helps and they give you some strengthening or stretches to do besides manipulation, that's probably fine. But so many chiropractors are different from each other. It's hard to really give a straightforward answer.
Yeah, I agree. Like every profession in the world, some people are good at what they do and some people aren't. And so if you're getting benefit from it and you're happy with that benefit, then that pretty much answers your question.
Yeah.
But again, understanding the philosophy of most chiropractors is important here, that they think that most chiropractors believe that the spine is the source of all pain in the body. And hopefully, if you've been listening to this, you understand that, well, the shoulder blade feeds into the spine, which may cause disruption, in the shoulder or pain or radiation or whatever. But if you're not actually addressing the shoulder blade, then the spine is going to continually be going out. That needs that whatever correction that chiropractor is doing that makes you feel temporarily better. So, my belief is that we shouldn't need to go to any practitioner once a week for the rest of our lives in order to be pain-free. Our bodies are built better than that. And so whether that's a chiropractor or a physical therapist or massage therapist or what have you, the better that we use our body and understand our body, the less we need to seek out help for pain. So I guess, hopefully this gives you a more informed idea about what your chiropractor is doing for you and if they truly are helping you. So, or maybe in addition to that, you find someone who can help you with your shoulder blade itself too. So, and then that might clear it up completely.
So our next question is one from before from Linda. I felt sudden sharp pain while using pruning shears this past summer. I still have aching, weakness, and numbness in my hand. The shoulder bones on that side seem to be more prominent than the other. Might I have dislocated my shoulder? I think if you dislocated your shoulder, that really hurts, unless it was a mild one and popped back in. But you have aching and weakness and numbness in your hand, so it definitely seems neurological in comparison to just a shoulder dislocation. I don't know how many shoulder dislocations have you worked with?
I've worked with a few. I've put in a couple shoulders after they've dislocated.
Jeez.
So
normally it's pretty obvious if it's out.
Yeah. So you have this big drop and gap in your shoulder joint here.
Yes.
I mean, it's a big one. So if most people don't function after their shoulder has been dislocated unless it spontaneously reduces itself again. And that doesn't happen that often. So my guess is I'm thinking, Mike, walk through this with me. I'm thinking pruning shears, someone's pruning like this, right? And they're pruning and they might be pruning up and down. And so this is right at that range where the shoulder blade should start to kick in to help you elevate your arms. But in most people, this is late in the equation. So it's not really kicking in to support anything. So what's happening is they're overly recruiting all of their shoulder muscles here to do all of the pruning instead of, having the rest of the shoulder system help them. And so pruning can be very strenuous, especially if you have thicker branches, you're squeezing that kind of thing. So my guess is that they likely, and again, it sounds like a sharp pain and it sounds like a sudden pain. So right off the bat, I'm thinking, I wonder if this is a tear of some sort, or maybe they have a bone spur in their shoulder that they were bumping up into, and that just really irritated and aggravated the rotator cuff muscle. So it's also possible that because of they could have developed a bursitis because of repetition of pruning and the force and the poor mechanics of it all. So especially, this is just what I'm thinking is this is more specific. It's maybe not, I'm not thinking this sounds like a shoulder dislocation. I'm thinking it sounds like a shoulder impingement, slight tear, something like that, bursitis, something like that, that's going on that hasn't healed yet. So, I don't know if this person has been to a massage therapist or a physical therapist or what have you, but I would, try to get someone to look at the shoulder and see and evaluate it to see, because there's a ton of orthopedic tests that we have in physical therapy to determine what is torn, where the tear is, and things like that. That would probably be one of my first steps.
My only curiosity is they have weakness and numbness in their hand now too. So that's why.
Well, that's true. So it is. So you're right. So it could be a neurological issue.
Yeah.
But again, the neurology may be compromised by the whole shoulder system acting on the neck in the first place.
Yeah.
So, and also weakness is a function of pain. If we have pain in somewhere, then often that helps the muscles shut down because they don't want to experience pain. And so this may also be a cause of that too. But you're absolutely right, Mike. I had forgotten about that part.
Well, I can see it in front of me. You're kind of going off what I said right now.
So again, the answer, and I hate to sound like a broken record, but it sounds like it needs to be assessed by a medical professional.
Yeah.
To get a better idea of what it is that you're dealing with.
Our next one comes from, I don't even know what it's some weird username. Sky Snowboarder. There we go. I can read it now. Sounds like they have shoulder pain after swimming and been doing a lot of stretches, but don't seem to help. They're not sure what's going on.
Yeah. So when I think of a swimmer, I don't know about you, Mike, but I think of someone who's very flexible.
I think of Brad. Brad swims.
Oh, okay.
He has shoulder pain too, so that's why I'm going to Brad. But
okay, I think of Michael Phelps.
Yeah, a little bit different.
I've worked with a lot of swimmers, and these people, especially I don't know if this person is new to swimming or if they've been doing it for a long time. If they've been a long time swimmer, then it's likely that they are more mobile than most people, especially through the shoulder joint. And so, therefore, stretching is usually not the solution for people who are highly mobile. And usually it's a strengthening problem instead. And again, with swimming, especially if you can imagine swimming, that arm is reaching out. So it's like an overhead reach. Again, I used to work with a swim team to help them with all of their injuries. And one of the most common things I saw in the upper body system was that none of their shoulder blades were moving. And it's because what they were doing was they were reaching out and then pulling through. But when they were reaching out, they weren't actually reaching through their entire body. If you reach through your entire body for that stroke, that's going to open up the rib cage and it's going to kick in the shoulder blade to start elevating and upwardly rotating on that stroke, rather than what I've seen a lot of swimmers, and especially if they haven't been doing it a long time, they're swimming and they're just using primarily just shoulder muscles to generate their power instead of reaching enough to incorporate the whole shoulder blade to help them with that shoulder motion. So I guess, my question would be, if you've been swimming a long time, then it may be a hypermobility issue in the shoulder and an overuse issue. And if you haven't been swimming a long time, then maybe you're not reaching through the waist and shoulder blade enough to get that scapular power to help you with your stroke.
All right, next question comes from KDog100. I have completely torn rotator cuff and am usually in pain and unable to teach yoga. 3 months of PT, a bit better range of motion. Surgery or not? I have extreme fear of anesthesia, surgery, and long recovery. Most full tears I've worked with never really come back. I've worked with partial tears and impingement, and they've been fine from just PT, but normally a full tear not. They often do need surgery. They do have, what they do is they do a block in your brachial plexus, like the nerves in here. I've had it done when I had hand surgery, so they don't have to give you anesthesia to go to sleep, but you obviously have to talk to your surgeon. It's just most people prefer that because it takes a few hours and you're just kind of laying there with a limp arm, but you don't have to do anesthesia if you're worried about that.
I think that's a great answer, Mike. I wouldn't really add much to that. Full tear, and especially it sounds like you're young and active, and you've got many more decades of use with the shoulder. I think, it would be worthwhile getting that repaired now and talking to your potential surgeon about alternatives for anesthesia to see if there's something else that you can do, and explain your fears to them.
Well, didn't you have a shoulder surgery recently?
I did. Yeah.
What did you have done again?
I had my acromion scraped out. I had a labral tear, and I had that shaved. And then I had my biceps moved to my arm bone. It's called a biceps tenodesis.
Oh, okay. So what did they do for that? Did you go under?
Yes, I had a spinal block and I went under.
Yeah. I just prefer to go under too, personally, because I don't want to deal with all that. But
so they did both.
I guess I was awake and they just did a tourniquet for my hand, because you can't tourniquet the shoulder because a tourniquet goes there for shoulder surgery. Like, it wouldn't work.
Yeah.
But I had a tourniquet for hand, and it's really weird because they just put that thing on tight and it feels like you don't even have an arm. But I mean, it comes right back. But that was just a wire removal. So that was only like a 20-minute procedure. It's pretty quick. But
yeah. And speaking of that, Mike, I want to throw out, because I just did this with my shoulder today, because I've been experiencing continued post-surgery pain in my shoulder. And so, and I know that my biceps tenodesis is functioning, because I can do biceps curls again, not the weight I used to, but it seems to be operating fine. I don't see any problems there. So I'm guessing that the shoulder pain that I have is due to the scraping of my acromion, because it also was too thick, and they pulled a whole bunch of bone chips out of my shoulder too. So anyway, I've been dealing with continued shoulder pain, and it made me think of our talk today, because one thing that I'm taping my shoulder right now, and this might be a lot of help to a lot of you out there who are dealing with a lot of shoulder pain right now, is that oftentimes the arm bone is kind of hanging on the shoulder joint here. And if things aren't working well, or if it's really irritated, then, it just progressively becomes irritated more, and it creates this vicious cycle. So what I'm experimenting with myself today, and so far it's working really well, is the shoulder taping technique that I've devised to help with just these types of problems that I completely forgot about until this morning. So basically what you do is, most people have heard of kinesio tape, and that can work well. I use Leukotape P and Cover Roll Stretch tape, because they secure a shoulder joint or any other joint much better than Leukotape P. But if you don't have that, you have Leukotape P. Rather than kinesio tape. If you have kinesio tape lying around the house, then try it with this. So basically what you do is I'm going to do it with my own arm. So you hold your arm out to the side or forward or something like that, and you run a piece of tape from the neck down to almost the elbow. And then especially if this is like kinesio tape, you'll notice when you lower your arm down, what it's going to do is it's going to stretch that tape. And so now the tape is unloading the shoulder joint significantly. And it could be just the thing that interrupts this pain inflammation cycle enough for tissues to heal. Because often if you have chronic pain and inflammation, that inflammation itself, causes tissues to be more irritated, and then more pain, which causes more inflammation, and you're just stuck in this cycle. So holding the arm out either to the side, or I did two pieces of tape. One, I held my arm to the side. One, I held it more forward, and I rotated my hand up on the second one so that I would offload my biceps tendon, because that was moved. And so when I lower my arm down, I can feel that the tape is now holding my shoulder in the joint rather than my muscles. And my irritation in my shoulder went to almost zero almost immediately. So I'm going to keep this tape on for, a week or so, and try to decrease all the inflammation in my shoulder. So those of you who are suffering from chronic irritation in your shoulder, rotator cuff irritation, tears, things like that, this taping technique can unload that immediately for you, and help. And it might be just that interruption in the pain cycle might be enough to help you start healing and getting through this. Now, fortunately, I understand exactly why my shoulder is so irritated, and it's because of all of the surgery. And then I aggressively went after my rehab exercises, maybe a little bit too aggressively, and irritated that surgical site. And so now I've just got to lay off and let the tape unload the joint for me and let it all heal. So this is this taping technique. I don't think we put it in the top 3 fix book because it's a fairly specific taping technique for a fairly specific problem. But it seems like all the questions that we're getting today is dealing with a very specific type of shoulder pain. So this taping technique might be helpful. This tape is, I've written a shoulder and elbow pain book on Amazon. I think I came up with this taping technique after I published that book. So it is, though, in my digital home program for shoulder and neck issues. And so I have 2 taping techniques, one to fix the scapular issues and one to fix and just to unload the shoulder joint itself for rotator cuff irritation. And that has worked quite well for a lot of my patients. But just going by this description, hopefully you can do that yourself and reproduce that and just keep that tape on for a few days or a week and see if that unloads your joint and gives you some relief and lets tissues heal.
I'm going to try to pick some questions that we haven't really specifically addressed yet, just to get some variety. So Shane Walden says, I've been getting pain in one shoulder during and after pressing movements, so bench press, overhead press, etc. Pain dissipates as the day goes on. It does seem to help if I really lock things down and back, but I like it to go away altogether. So I think what he means with benching down and back is you squeeze down, get your core going, and then you go down and back, so you're benching. I haven't had too much pain with that personally when I've done that, but I know from seeing other PTs that work in this realm more, some of them will work on, if it's just one side, they'll work on the stabilizers. So what some people have done is actually either bench with a kettlebell inverted, so like a lighter one, so you have to work on the stabilization while you're doing it. So you just kind of go up and down to kind of stabilize the smaller shoulder muscles in there and see how that goes. Other times I've seen some people where they'll put a band around their wrists, a small loop band, and then they'll try to go up with that external rotation factor and try to get their scapula to engage as they're pressing overhead, because it could be a scapular issue as well. So it's kind of like your arms on the wall a little bit, but there's a band resisting, and then you kind of go up with the weight to teach the right mechanics. But I don't know. Do you have any other tips?
Yeah, well, the description of that bench press is the opposite of proper shoulder function, right? So the scapula's role is to support the arm bones. And if you're locking your shoulder blades down and back, then you're not allowing them to upwardly rotate or elevate or assist with that bench press motion. And so what, in my opinion, from a long-term standpoint, this is going to put your shoulder joint tissues at risk. So what I would tend to do, and this is my bias, Mike, is that most chronic shoulder problems I see is a lack of scapular mobility, because no one is training these people to use their shoulder blades to do lifting. They're just thinking that it has to be the shoulder muscles and their arms that do the lifting. And when I talk to people about shoulder blades and get them to incorporate it, it's like, I may as well be an alien from outer space. They have no idea what I'm talking about. And so one of the things I think that might be interesting is, what if instead of doing bench presses, you did push-ups? And you did the push-up with a little bit of plus, so you're rounding a little bit to help, and then allow the shoulder blades to come into your spine, but also allow them to come fully away from your spine. And what if you did a warm-up set of push-ups, like 10 push-ups, to activate the scapula, to get it involved better with that motion for you, and then you did that bench press. All right. So now we're waking up the scapula to help and assist with that potentially. The other thing is that if you're on a bench press, most bench presses will restrict scapular motion anyway. And so if you go up all the way and you're around that, and then your scapula come back, they're going to hit the edges of the bench press, and that's going to restrict the amount of retraction that they can get in the first place. So maybe doing your bench pressing on a floor or a mat that might allow for more freedom rather than a hard edge that's going to stop that would be beneficial. The last thing I would also recommend is if we sequence your workout a little bit differently and maybe do lat pull downs first before, also for similar reasons, before the bench press, then that again, the lat pull downs are about, I think of them as lat pull ups, because what they do is at the very top, your scapula is finally getting to come up, upwardly rotate the way it should be. And it's being pulled up by that weight. So that also starts to introduce more scapular mobility into your scapula. And now it's warmed up before you do your bench press. And I would be interested to see whether that allows you to bench press more effectively without pain.
I'm curious too, is it just barbell that bothers you, and is dumbbell fine? Because sometimes it's the path you choose. Because I used to go a wider grip and I was having shoulder issues with the barbell, and then I've narrowed my grip in recent years and I have no problems at all. So I think too, distance in or out can play a major role with that as well. So
Yeah,
some things to try.
great point. Yeah.
We had a follow-up question. Gail, who's watching, was wondering what those tapes were called you mentioned again.
Oh, okay. So the tape that I use is called Cover Roll Stretch. There are two of them. One is Cover Roll Stretch, and you would get a 2-inch wide one. And the second one is Leukotape P. And those are sold as a combination on Amazon. If you type in combo Cover Roll Stretch and Leukotape P. I use these tapes when I feel a joint is in need of a lot of assistance and guidance. Kinesio tape doesn't offer that as much because it's stretchy. And so things will move a lot more with kinesio tape on. However, with the shoulder joint, not all people need significant changes in their dynamics. Some people just need a little bit of a change, and that's when kinesio tape can work well. So kinesio tape is that tape that you see, the Olympic, volleyball players use, and it's really popular in a lot of sports, which I think is nice for gentle guidance of things. But like I said, Cover Roll Stretch and Leukotape P are good for actually, they're super strong tapes. So you lay down the Cover Roll Stretch and then you lay the Leukotape P on top of it. And the combination together, it's like, it will protect or move whatever is not moving or needs protecting. It's super strong.
Yeah, I would say like K-tape is nice if you're going to be functionally doing stuff a lot because it moves a bit more. But if you have a really sharp injury, I've used a tape you've talked about when I kind of had some heel pain before, and it worked really well because it really stabilized them together. Because the kinesio tape had too much movement for that issue. But our next question is, please address how menopause affects shoulders and how to address frozen shoulders. So I've done a few videos on frozen shoulders with Brad, and that is a common correlation of women in menopause and frozen shoulder. It primarily has to deal with hormonal changes, I'm presuming, which can affect the tendon health of your shoulder and different issues, but I don't know much more than that. I don't know if you care to elaborate.
Yeah, so, menopause is associated with estrogen drop. And estrogen drop contributes to sarcopenia, which is a loss of muscle cells. And so that then causes weakness to occur. It also, there's also osteoporotic changes that occur with menopause too. And so, if you haven't had your estrogen levels measured or haven't seen a doctor about this, then I would first see them to make sure that whatever menopause changes that are happening in your body are standard changes and not something that's out of the norm. So the way to help offset those losses is just gentle exercise and strengthening program. It doesn't have to be this extreme thing. Since we're talking about the upper body system, biceps curls, triceps push downs, or skull crushers when you're lying down, and then overhead presses with dumbbells and things like that, or flies or things like that. Those are the 3 exercises that you could do and cover almost all of your upper body muscles. You could maybe add a gentle push-up exercise that you do off a kitchen countertop, so you're not at this full horizontal position, you're elevated, so it's a lot easier. And just go to gentle fatigue, and you'll notice that in the next week or 2 that you'll be able to do more and more reps or heavier weights or whatever without really trying very hard. So I generally do recommend 2, maybe 3 sets, but I find most people get too bored with it to do 3 sets. And so 2 sets is certainly adequate to get some strength changes. And that's the strengthening also helps feed bone growth too, because it stresses the bone structure. So this is what would, I think, without knowing anything else about you, I would think those would be fairly safe exercises to begin. But this is what menopause is doing in terms of muscle tissue and bone.
Some of these other questions, they're all different questions, but they all have very similar answers. So I'm trying to pick a slightly different one. I'm just going to pick this one. This one comes from JT. So, hi, Rick. I partially tore the labrum in my left shoulder from 8 to 10 o'clock position, whatever that means. Oh, I'm guessing like a clock reference frame. Position 2 years ago when I was 30. I was able to do PT for 4 months after injury. Is about 90% better. Unfortunately, whenever I bench or do push-ups, so again, pushing motion, or sleep on my side, so this is their left side they're talking about, my labrum will have a nagging feeling for a couple days. I have full range of motion, but just uncomfortable sometimes. Will it get worse over time? Is arthritis a long-term concern? When should shoulder surgery be considered? I think if it's most labrum tears I've worked with, it just gets worse and worse, and they just get to a point where they can't stand it anymore. It's just gonna, if it's a bigger tear and gets more torn in there, you can have some compensation as well. I mean, you could be doing more long-term damage. So, I mean, I hate to say it, but probably sooner the better for surgery. I don't know what your experience is, but.
Yeah. So, the labrum, so if we have our shoulder socket here, the labrum is in the shoulder socket that helps deepen the socket, and it helps hold the humeral head in, and actually creates a negative barometric pressure in the shoulder socket to help hold that humeral head in. And so if you have a tear, you've compromised that negative pressure, and so there's instability in the shoulder right off the bat from having a tear. And so when we talk about 8 to 10, if we look at this as a clock, like you were talking about, Mike, the 8 to 10 zone would be here, all right, in the back of the clock on the shoulder. And so it's important to understand that it's likely that the physical therapy you've been doing is improving your strength, which makes you feel better. It's not improving the labral tear. So the labral tear, like you said, Mike, won't improve on its own unless, so in the labrum, there are vascular and avascular areas of the labrum. Vascular areas means that it gets blood flow. And so surgeons can stitch up those areas and they can heal. But if it's an avascular tear, then what they would do is snip the labrum, like what mine was done. And then just leave that, and you'd be missing part of your labrum. So, and so there's different types of labral surgery. If they stitch this labrum together, then that's a longer rehab process. But if they just clip it, then it's a shorter rehab process, because we don't have to dance around and wait for the labrum to heal from the stitches. So I agree with you, Mike. In general, labral tears will just get worse and worse as they go on. And while your strength has improved and your symptoms have improved, the labral tear likely has not improved. And I think the answer to this really depends on, what is your activity level? Do you work a lot with your arms? Do you plan to exercise a lot in the future? Are you a swimmer? do you do CrossFit kind of stuff, yoga, all that kind of stuff. The more that you're doing with your arms or you plan to do with your arms for the rest of your life, I would think, like you, Mike, that we would want to address this sooner rather than later so that you can go on and not worry about a progressively deteriorating shoulder joint, which then introduces more ideas like, arthritic changes, labral tear, rotator cuff tears, and bursitis issues and things like that. So I don't want to paint a bleak picture of this, but a lot of people, for instance, I think I've had a labral tear in my shoulder for years, and I know I have them in my hips for years, and still function fine and run on those. Now I know that my hips will be developing arthritis prematurely because of it, but that's a choice that I made because I'd rather live with the labral issues and continue running and doing the other things I have. And I understand that wear and tear, but that's a trade-off I'm willing to have. But your answer might be different. So I would go to your doctor, see exactly what you're dealing with here, go to an orthopedic surgeon, talk about the pluses and minuses with having surgery now, what the rehab process would be like, and whether this seems to be a progressively deteriorating condition or not. I think that would help you make the right answer for yourself.
Yeah, and most labral tears I've worked with recently, the recovery process isn't nearly as long as like a rotator cuff tear. It's typically a lot quicker. So,
Mike, even if they do a labral repair rather than a labral shaving, do you find?
I think the one I had just did the stitching. Like, I don't think it was the whole removal one. There's one right now I can think of, and she's progressing pretty well. She was really bad early. She was like, she could barely get here and it just hurt like crazy. And she's not, she was like 40. Like, she's not that old either. So,
yeah. So youth, that brings up a good point. The younger you are, the faster you're going to bounce back from these things once they're repaired. So, take that into consideration too.
Yeah. JT, you're only 30. Okay. The next question comes from Praise Jesus Every Day. Hi, thanks for doing this. Please help with right shoulder AC joint pain when doing some strength training pressing exercises. Thank you. So I personally have a AC joint sprain, happened last fall. I still have unless you actually get surgery, if it's really bad, most of the time a grade 1 or 2, you don't need to do anything. They just kind of heal on their own, but I do have a nodule right here in my shoulder. You can't see it with my shirt on, but it's higher up. For me, it took probably 3 months and I didn't notice it at all. Sleeping on that side, you're probably not going to do it for a while. For sleeping, pressing movements were the worst. Overhead was actually a little bit better than pressing. That was so much worse for me personally. But do you want to give any more detail on that? I guess we could tell people what the AC joint is. I don't know it.
Yeah. Oh, you want me to say that?
Well, you have the
you
skeleton.
Were doing so well. All right. So the
clavicle
AC
acromion process, but you have the nice skeleton to show it.
Okay, so I'll put it really close to the camera. So we have the clavicle, right? That's the C part of the AC joint, and then that meets the shoulder blade here, and the part of the shoulder blade it meets is the acromion, which is this part. So the AC joint is the acromion clavicular joint. And so again, that little taping technique I mentioned earlier might help unload this joint. So if it's just an irritation to it, it might help calm that irritation down enough for you to get by and then, wean yourself from the tape. But in general, like I agree with you, Mike, most AC issues, unless they're very severe, will, heal on their own, or they can be quite painful because again, the AC joint is the shoulder blade's connection to the thorax of the body. So there's a lot of pivoting going on there. And so, but in general, for these types of things, I would start with exercises that you're able to do, gentle stretches like that all fours rocking stretch that we've talked about a few times, or sliding the hands up the wall, or if you're in a weight room, doing the lat pull up and focusing on the upward motion of that and letting it stretch out that whole system for you. those kinds of things, and then, gentle strengthening and build from there. So it should be okay if it's not a more serious AC joint issue. The question though is, is it arthritic? Has your acromion thickened over time? Has it developed a bone spur that then is impinging the rotator cuff muscle, running through that little cave in there? So there are lots of questions that we don't know about the status of your shoulder. And I'm going to sound like a broken record, but getting an X-ray and or an MRI would help you know exactly what you're dealing with and how to move forward from there, given that information.
Next question comes from Tom28 Jerry. Was told that bursitis in the shoulder, but there seems to be no relief. Toss and turn at nights. It's hard to get rest. Just living with the pain. Are there any exercises or therapy that can help with this issue? Do you have anything?
Thoughts, Mike?
I don't see a lot of bursitis necessarily. I see more hip bursitis, and it's strengthening, stretching, and maybe some ultrasound with some anti-inflammatory medication on it, but that's about it.
Yeah, so itis just means inflammation. And so bursitis, the bursa is just a fluid sac that helps tendons roll over each other better so that, there's not a lot of friction and irritation. So the fact that a bursitis issue is happening means that something is not functioning properly and there's excessive friction in the shoulder joint that's then causing the bursa to become inflamed and irritated all the time. And I'm assuming this person has probably tried rest and, laid off the activities that they typically do. And if they haven't, then I'm sorry to say that would be the first thing I would ask you to do. But secondly, I would also have you go see a physical therapist to assess your shoulder function to see whether you have dysfunctional shoulder blade and or mechanics of arm movements and so forth that is then causing the bursa to become, undergo friction excessively. So if you want to, I would try the taping technique that I described earlier in this podcast to unload that, because usually bursitis is felt somewhere up here. And so by unloading that joint and having the tape hold that up, that relieves a lot of tension on those tendons that are rubbing on the bursa. And that could also help you quite a bit too. So, and then you would just wean yourself from the tape as it calms down. But ultimately, the problem is likely to have something to do with your shoulder function. And so, again, sounded like a broken record, but it really works. That all fours rocking stretch that I have talked about a few times helps restore proper shoulder blade mechanics and stretches tissues that are excessively tight that are disrupting shoulder blade mechanics. So that would probably be the first place that I would begin with you.
And then because they were mentioning tossing and turning at night,
oh yeah,
it's kind of hard. I would just suggest getting a pillow. If you're laying on your back, kind of a pillow underneath you to just get some support and pressure off it. On your side, you kind of have to do a 2-pillow thing, but just keeping it elevated and away from your body and not tight in sometimes can help. But obviously don't try to sleep on that side because that's just going to make it worse.
Yeah. And again, and it's funny because a lot of people will roll to that side, because that's the way they're used to sleeping. So if you were here at the beginning of the podcast and I had that little pillow here underneath the rib cage, if you put a pillow here underneath your rib cage, it creates a trough that unloads the shoulder joint. And so that might be, maybe the bursitis is in part caused because you keep sleeping on it and re-irritating it during the night and you can't get off of it because that's your preferred sleeping position. Okay, well, let's try the pillow underneath the rib cage to unload the bursa contact with the bed. In those cases, often you need to add another pillow to your head too, because you've just raised your whole trunk off the bed a little bit. But I would try that too to unload the bursa, and maybe over a week or two with that and the shoulder taping that we discussed earlier and the all fours rocking stretch, maybe between the three of those things, this thing will calm down.
All right, I'm going to do one last question from a live viewer. So this is SP again. Is Pilates okay with shoulder pain? I would say if the Pilates is making your shoulder hurt, you probably have some dysfunction. If the Pilates feels good, then it's probably fine.
Yeah, that's a good general truth. So it's important to understand that Pilates originated out of dance discipline. And so it was Joseph Pilates worked with a lot of dancers and rehabbed a lot of dancers. And so a lot of dance philosophy is built into Pilates philosophy. And by the way, I'm not just picking on Pilates. Yoga is the same because this has happened with them. Well, Mike and I kind of touched on this earlier, is that a lot of these disciplines, and also gymnastics teaches this as well, is that they believe that we must have a long and erect posture in order to look good, aesthetically pleasing. But and then the cueing typically is that, okay, pinch your shoulder blades together, down and back into your back pockets, which of course does create that long neck, but it's the exact opposite of how the shoulder blades should be functioning. Like I said, the purpose of the shoulder blade is to assist the arm in moving overhead. And the shoulder blade should start moving at approximately 60 degrees of shoulder flexion. So, however, if you're being instructed to pinch your shoulder blades down and back into the opposite back pocket and raise your arms up overhead while keeping your neck nice and long, then you are doing the exact opposite of what your shoulder blade is designed to do. So from that standpoint, yes, if your Pilates instructor is teaching you that, or yoga, or gymnastics, or dance, or whomever, then that is teaching you improper dysfunction, and that is what is contributing to chronic neck pain, headaches, shoulder dysfunction, and so forth. So you can still go to that Pilates instructor, but just simply ignore those instructions and think about reaching up with your entire shoulder blade to reach up, instead of just keeping the shoulder blade down while your arm reaches up. It should feel much better almost immediately. It will feel unnatural because you've been trained so well not to elevate your shoulder blade. But that unnatural feeling is actually what you're going for, because you've been unnaturally trained to keep your shoulder blade out of the equation.
All right. Well, I think that's a good amount of questions we got through today. Thank you, everyone who's been watching or listens to this later. Rick and I are going to do at least monthly. Maybe we'll up it, some live Q&As. We'll just kind of pick a body part and answer some of your questions. So make sure to stay tuned. And you can find Rick at rickolderman.com. And you also have a YouTube channel. Is it just Rick Olderman?
Yeah, it's I have a YouTube channel. I make little short videos, not as entertaining as you guys, but I answer a lot of these questions. And then also for those of you, I have created home programs to help people solve pain. And while I haven't created a shoulder pain program, the neck pain and headaches program I have on my website addresses shoulder blade dysfunction as it causes neck pain and headaches. So from that standpoint, it also solves a lot of shoulder pain too.
Well, thank you for joining me today, Rick, and thank you for everyone for your questions, because you made this podcast possible.
Thanks, everyone.